Hello all, today I am going to talk to you all about colorectal cancer. What does colorectal cancer mean? It is cancer of the large intestine, which includes colon and rectum. What are the risk factors for colon cancer? Colon cancer was once upon a time considered a disease of the West. But over the last few years, we have seen an increasing incidence even in countries like India. The risk factors include obesity, diabetes mellitus, diet. Diet plays a major role. Eating a lot of red meat and less vegetables and fruits may also contribute to colon cancer. Apart from this, certain individuals may have certain diseases of the large intestine like inflammatory bowel disease or even polyps in the colon or rectum, which could also be a risk factor for colon cancer. Smoking and alcohol are also known to be risk factors for colon cancer. There are certain syndromes running in the families, or some individuals have family history of colon cancer. This also is a major risk factor for colon cancer. So how do these patients present? They present with weight loss, usually elderly individuals, but these days we are seeing individuals in a younger age, even in 40s and 30s, developing colon cancer. But otherwise, generally it's a disease of the elderly. Altered bowel movements like diarrhea, constipation, blood in the stools, pain abdomen. So these are the main symptoms of colorectal cancer. Now, how do we diagnose colorectal cancer? We do what is called as colonoscopy, which is an endoscope which goes into the large intestine, and we can, so that ulcers can be visualized and they can be biopsied, and the biopsy specimen is seen under the microscope for cancerous cells to diagnose colon cancer. Now, how do we stage this condition? We do a PET scan, so that way we know where all the disease has spread, and depending on that, if it is a stage 1, stage 2 or stage 3, we know that we could go ahead with surgery up front, and subsequently in stage 3, we give additional chemotherapy to prevent the disease from recurring. But certain times we see that the disease has spread to the liver or other organs. If it is very much limited to the liver, certain times even in such a situation we could go for surgery after giving some chemotherapy. But otherwise, if it is spread to other organs like say lungs and liver, in both the lobes of the liver, if it is extensively spread, in that kind of situation we might have to go for only chemotherapy. Chemotherapy is combined with targeted therapy, and we are able to prolong the survival even in stage 4 disease with good quality of life.